Kia ora, and welcome to an explainer video by Women's Health Action Trust. In this video we will be exploring how the social determinants of health affect women. There's a saying in the medical field that women get sicker but men die quicker. And it's true, women are more likely to feel sick, take days off work, be on higher quantities of medication and visit doctors more often. But why is it that women spend more of their lives ill? As we know, there are biological differences between males and females, but do these alone explain disparities in illness? Research suggests they do not. Gender and where you identify along its spectrum can have a massive influence on health. This is why gender is such an important aspect of the social determinants of health model. So, why does being a woman make you more likely to get ill? There are a multitude of reasons, and we will explore some of these in this video. Bias in healthcare. When women are sick, they are less likely to be believed by medical professionals. This means they spend more time ill. An example of this is endometriosis. This is a painful uterine disease which affects up to 1 in 10 Kiwi women, but little is known about the illness and the average time to get a diagnosis is a startling 8 years. Additionally, bias in medical research has meant the male body is treated as the norm, and therefore most research and knowledge we have about health is less relevant to females. There's strong evidence that certain drugs and diseases work differently in female bodies, yet due to male bias, a lot of this is left unknown. An example of this is aspirin, which is a commonly prescribed drug to reduce the risk of heart attacks. This is found to be a helpful medication in males, but recently when further testing was conducted in a female population, researchers found that the drug was not only not helpful for reducing heart attacks, it was actually more often harmful for women. Social positions also play a role, and women's positions often lead to stress and fatigue. In modern society, many women will be employed and then are also expected to run the household, including housework, childcare, and looking after elderly parents. This is often referred to as working the double shift. 75% of this unpaid labour is undertaken by women globally, and working the double shift leads to mental and physical exhaustion. The stressful family life is correlated with illness. In fact, married women with children live shorter lives than their unmarried childless counterparts. Economic inequality is hugely influential. Even though women hold more university qualifications than men, they are underrepresented in the workforce, particularly in the higher positions their qualifications should have afforded them. Women can be expected to be paid less for their work, are more likely to be in precarious working situations, and have higher rates of part-time and short-term contracts. Socioeconomic status is a key predictor of health, and women are economically disadvantaged in our society. These influences on health do not operate alone. Instead, they intersect. A person is not simply a woman, they are also their ethnicity, their social class, their age, their sexuality, and so on. Because all these factors intersect with one another, they can compound. The less privilege someone holds, the more likely they are to be ill. This causes disparities in health even among women. For example, women of colour face higher rates of illness than white women. This is because white women hold more social privilege. A clear example of this in New Zealand is life expectancy. Due to colonisation and discrimination, Māori women often live shorter lives than their non-Māori counterparts. There are many social determinants that influence women's health, and it is important to keep these in mind. This is because health is often a result of social factors, such as the ones explored in this video, rather than individual choices. At Women's Health Action, we maintain this lens throughout our work. To find out more about the social determinants of women's health, visit www.womenshealth.org.nz to find out more about the work we do in this space.